Hello and welcome to today's live webinar on mouth cancer brought to you by PortmanDentex. I'm Dr Asad Rahman, one of the clinician engagement leads at PortmanDentex, and I'm delighted that today my colleague Dr Kevin Caruana, who is our lead clinician at the Smile Spa in Stockton-Tees, will also be joining me. Mouth Cancer Awareness Month takes place every November in the UK. It's a national campaign aimed at raising the awareness of mouth cancer and educating us all about its signs and symptoms. Sadly, mouth cancer is one of the most common types of cancer in the UK, with over 10,000 new cases diagnosed every year, and this equates to about 30 new cases every day. Despite the high incidence, awareness of mouth cancer remains low, with a recent survey finding that 60% of us in the UK are unaware that mouth cancer could be detected during a routine checkup with your dentist. So our aim today is to discuss this incredibly important topic. Throughout the session, Kevin and I will be answering your questions live, so feel free to drop them in the chat at any point. And by the end of the session, we hope that you'll leave with a greater awareness of mouth cancer, an understanding about it and how to detect it early. So let's dive in. I'll ask Kevin to join me on screen. Hi, Kevin.
Asad, how are you? Thanks for having me.
My pleasure. Thank you for joining me. So, Kevin, I think obviously to start off with, we'll start to discuss, what are some of the common causes of mouth cancer?
Okay. So basically, Asad, anybody can get mouth cancer, but there are some things which make it more likely to get mouth cancer. Smoking, not smoking necessarily only. Tobacco use is a big one, whether it's in the form of cigarettes, cigars, pipe smoking. But there's also other ways that you have to be careful with tobacco. Some people chew tobacco, or they use things like betel quid, pan, or gutka. These are actually worse when you're constantly with that tobacco in your mouth, with that chemical attack in your mouth. So if you stop smoking is a big message out there to reduce the incidence of mouth cancer. Another alcohol is a big one as well. So heavy drinking also increases your chance of mouth cancer. And again, it's that alcohol topical effect on the mouth. So I would strongly advise people to kind of limit the drinks. If you smoke and drink together, the effect is also amplified. So it's not a case of 1 + 1 = 2 anymore. It's 1 + 1 = 7 or 8. So it's best not to do them together because the risk is highly increased that way.
Yeah.
Another cause, which many people might not be aware of, is sunlight on your lips. So you go on holiday, you're staying in the sunlight, you're putting sunblock everywhere, but not on your lips. And you do get lip cancer from that as well. And one other thing that's coming up as more of a factor is human papillomavirus, HPV. You can't really tell if somebody has HPV. You could have it in your body and it gets activated 10 years later. And it's estimated that 80% of adults have got HPV. The good news about HPV is that cancer caused by HPV is more curable than the ones who are not caused by HPV. So that's very encouraging.
That's positive.
A silver lining, which is quite nice to hear, which you don't always get from us.
Yeah.
So of course, then I suppose the next thing would be something like, how do you prevent mouth cancer? So as we said, smoking, stop smoking. If you have some people, I've had actually patients who stopped smoking but started chewing tobacco, or they've got these pockets of tobacco you put under your lip, and you see this big red mark after. That's a chemical insult, which you're putting yourself at risk. So don't do stuff like that, please. And of course, cigars and pipes are not better than cigarettes, so don't smoke with those either. And similar things with chewing tobacco, betel quid, pan, gutka, just please stop. Alcohol, if you can stop drinking alcohol, better, but at least cut down your intake and be responsible in how you enjoy it. Sunlight, as we said, sunblocks, and HPV. Now, there is a program in the UK where children get immunized for HPV at the age of 12 to 15. And the really nice thing about that is it is working. So they've done studies where they've seen the effect of it, and the people who are now early 20s, the risk is a lot less as well.
Yeah.
So, I do encourage you to take the vaccine. I mean, some people might ask, can I have it at a later age? I mean, it's available until the age of 26.
Okay.
And, if it's made with a male partner, you can have it up to 45. And if you're over 45, you can discuss with your doctor to see if you can have it. But it's usually a private thing, and you pay, I think, a couple of £100 per vaccine. And of course, with HPV, how is it transmitted? So it's skin to skin. And as we said, 80% of adults have got it. So it's kind of difficult sometimes not to catch it, I'll be honest. But if you want to minimize the risk. So, of course, kissing, of course, don't be kissing everybody around, stuff like that. Practice safe sex, even though things like condoms don't work very well because it's skin to skin, so the rest of your skin is still exposed. One thing I would like to share, actually, which I think is very important, do not share your toothbrush.
Yes.
Please do not share your toothbrush for any reason. It's not a nice practice. And even if you're in a hotel, just put your toothbrush in a bag, well hidden, because you don't know who's coming in and maybe using it, stuff like that.
I think, you sometimes on occasions get patients who do mention that they've shared a toothbrush with somebody, and that's a good point, yes. And
I think as dentists, we're aware of how dirty the mouth can be.
Yes.
I don't think people realize, or they say, well, it's family. But, especially adults with children, I mean, you might have HPV and not knowing, and you're passing on to your child. So don't share toothbrushes.
And I think the main kind of point that you're getting across is prevention is better than cure, as with any cancer. And I suppose then, does a healthy lifestyle in general come into that factor? So
thanks for reminding me.
Fruits and vegetables and things like that.
Exactly. So try and stick to your 5 a day. Exercise. These are all things that keep you healthy and keep your immune system better acquainted against bad cells. Because what is cancer at the end of the day? It's a group of cells that starts growing uncontrollably. Now, usually if that happens, your body destroys it. But if the policing gene is damaged, is defective, then that keeps happening, and your body hasn't got no control over these cells. But keeping healthy and your immune system active is very, very important.
Yeah, thank you for that, Kevin. I think as dentists, it's about also sharing the importance of kind of the routine dental checkups and diagnosis. So if anyone's kind of wondering, what exactly does a dentist do to diagnose mouth cancer? And I mean, specifically for you, what are your kind of protocols when you're conducting a normal examination to make sure that you pick up if there are unfortunately signs of mouth cancer?
Definitely. So as you said, Asad, the key is to catch it early. So you want to be suspicious of any lesion. So what we tend to do, let's say you're coming for your checkup, some people don't realize it's happening, although I think it's a bit difficult not to realize nowadays. It's quite involved. So first of all, we have a good look at people's faces, skin, neck, and make sure there's no lesions which might be looking suspicious. So that's outside the mouth, but you still are looking for those things.
Yeah.
Then, of course, we start palpating. So we start checking the lymph nodes. Now, the lymph nodes are like a drainage system in the body where the fluids pass through it, and you got blood cells which are filtering and fighting disease. But of course, if there's a cancer cell passing through it, your lymph nodes are also reacting to that. So we tend to palpate underneath the neck. We go around this muscle as well, behind and in front of it, all the way down here, and even up from above your collarbone. And I like to touch around here as well. There's lymph nodes here as well. And what we're looking for is lumps and bumps. Now, you could have had a cold and your lymph nodes might be a bit swollen. That's normal, but it usually goes back to normal after 3 weeks. So we're trained to check for these things, and we do it so many times. We know what feels normal and the variations. If something's kind of, that is not quite right, then we'll discuss with the patient and, proceed further. Then, of course, we check inside the mouth. And usually we use a dental mirror. We check roof of the mouth, cheeks, tongue, floor of the mouth. We ask usually the patient to stick the tongue out. Some dentists even grab the tongue and check, to check every surface there is. And if there is something suspicious, like red lesions, white lesions, ulcers, we try and find out what might be the cause of that. And if it's suspicious, well, it depends. If you think, well, somebody's bitten their tongue and they admit to that, we tell them, right, okay, if it's still there within 2 weeks, give us a ring. If it's something like a white lesion on the side of the tongue and we're suspicious, I tend to bring them back 2 weeks later, have a look, see if it's changed, sometimes take a picture. There has been cases where it was so suspicious, I've referred straight away to the specialist. But that's how we check, basically. So when you see your dentist touching everywhere and you think, why is he not checking my mouth? He's checking for cancer. All right.
Yeah, thank you for sharing that. Yeah, I think it's important to highlight that those are the checks that can get the earliest detection. And you touched on kind of the referring a patient. So if unfortunately a dentist was to notice, what would they do for the patient in terms of referring them, and what's the kind of general process that someone should expect?
That's the key thing as well, actually, because you cannot tell somebody has got 100% cancer until you take a piece and check it under a microscope. We don't do that in general practice. We have to refer to hospital, to a maxillofacial surgeon to check that for us. And there is this system called the 2-week cancer rule. So I send this letter, not even a letter, it's a email nowadays. So you fill it up, they receive it in a hospital, they confirm to us that they have received the letter. So if we don't get anything back, we know this might not have been received. And they're really good. They see the patient within 2 weeks, if not earlier. They very highly specialized consultants. I mean, these people are dentists, then qualified as doctors, and then qualified as maxillofacial surgeons. I think you qualify when you're 40 years of age. Very highly experienced people who deal with cancer all the time. And they're very happy checking if there is something. And they usually sometimes need to take a biopsy, which is like a bit of cells from there, send it to pathology, check what there is, and they liaise with you then with oh, it's fine, nothing, or no, we need to investigate further, and maybe carry out surgery.
And I think that's important what you've highlighted there, that the process is quite set all across the country in the UK. So we're quite lucky with that, aren't we? Where patients are generally seen within the 2-week window. And I suppose for patients, it's for your peace of mind, isn't it? Because you don't want a dentist to potentially tell you this news that you have this lump and then waiting a long time.
Exactly. It's never a nice thing to break to the patient, but no. I must say, I mean, a good 95% of cases I have referred have been nothing. So I tell patients, right, okay, don't lose any sleep on this, but I'll need you to go and have it checked. Yes. That's usually what is the case. If it's nothing, fabulous, we know it's nothing. If it is something, though, you want to know and you want to catch it as early as possible. Exactly. And that's why we take such quick action on it.
Yeah. Brilliant. Yeah. And I mean, in your own practice, I can see you're in surgery today as well, working hard, seeing patients. Yeah. And have you seen any cases of mouth cancer in your career? We normally get told as dentists you'll see one in your career, but sadly, as I was mentioning, it's maybe increasing now, isn't it? So have you personally seen any cases?
Yes, definitely. I mean, I've seen one lady where she had an ulcer on her side of her tongue, and there was a sharp tooth, so we were adjusting it, but it wasn't healing just with the adjustment of the tooth.
Right.
So that was mouth cancer.
Okay.
I have had a late cancer diagnosis as well, right after lockdown, which was quite sad, really, when she came for pain and possibly replacing a tooth. And when you literally had a look, you could see lumps and bumps, exposed bone. That's the one case where I thought, no, this definitely is, and I got her referred as soon as possible. But it was a late diagnosis. Recently, it wasn't in the mouth, it was on the neck. So doing a checkup, and there was a biggish lump here. It felt a lot like a balloon filled with water.
Yeah.
this kind of consistency. You only think to yourself, it's one-sided, not unilateral, you have to kind of both sides. And I actually advised the patient to see the doctor about that one, and they did. And it turned out to be cancer, very early start. So I'm praying for that one to be completely gone and gotten rid of. So that would be a really, really, really nice news for us. I think you, like me, you kind of success is just amazing. I love success. You know, if somebody's got cancer, you can get rid of it. That is just finally, you know, you got it early. And then other things which I haven't diagnosed myself, but then of course, if somebody has had cancer and you keep looking after them. So somebody, for example, with lip cancer that was caught early, stitched, you can hardly tell that the person had lip cancer, and you keep on looking after a dish checkup and making sure that it's still stable. So any changes, you want to refer them. And I've had even patients with radiotherapy, but of course you have to manage those patients after, making sure that the mouths are healthy, you're not needing to have teeth taken out. So the aftercare is quite important as well.
And I think that highlights what you've just mentioned, because it's that combination of a dentist and a doctor, doctors in hospital working together to diagnose this. So, I mean, we're having some questions come in, and I suppose one of the questions is somebody's asked, they're worried about wasting a dentist or GP's time if it's nothing. Will they be judged if there's a check and it comes out to be nothing?
I don't think there's any dentist or doctor with a patient who thinks they've got mouth cancer that will say, oh, what a waste of time. We're just absolutely glad to see you. And just, even if we say, oh, no, it's fine, nothing to worry about, it's normal anatomy. And, you know, we'd rather do that than find out later that you've got cancer.
Exactly.
So don't even wait for your checkup. You know, please don't wait for your checkup. If you have something, some concern, give us a ring, and we want to see it, definitely.
And I suppose that then goes on to symptoms, because early on there probably will be no pain necessarily, just a slight kind of lump somewhere, a lump or bump that you've noticed. But questions come in kind of if people think they have symptoms, what kind of symptoms would they notice if it's kind of a bit further along, in terms of, is it pain, is it sore, etc.?
It varies wildly because it depends where the cancer is and what it's about. I mean, a sore on the tongue is usually painful, but you can get completely painless ones. So I would say look for red, white patches and ulcers that don't heal for 2-3 weeks. Definitely give us a ring. Just keep an eye on it. Take a picture of it. I mean, this patient was late cancer, for example. She had pain, but she wasn't in agony. You know, she thought she needed, the tooth was failing and needed to be taken out. So it doesn't have to be extreme pain. It could be literally completely asymptomatic, just no symptoms whatsoever. But look for red patches, white patches, ulcers that are not healing, and lumps and bumps which weren't there. Definitely give us a ring. Okay.
And I think that goes back to the 6 monthly. That's why often the advice is a 6 monthly checkup, because it's not just maybe your teeth haven't changed, your gums haven't changed, but these are the factors that we can spot every 6 months.
As dentists, we're in a very good position actually, because you don't tend to see your doctor for a checkup every 6 months.
Exactly. Yeah.
With dentists, I mean, the job entails that you see the dentist every 6 months to a year. So it's quite frequent in medical terms compared to what is usually available. And that's why we make the most of that, and not just the teeth. We check for these early signs as well. And to be honest, I mean, you want to catch it early, but it's in your face. You want quick diagnosis.
Yeah. Brilliant. There is no further questions that have come in. I think in terms of the main kind of summary of points, that there might be a few other questions coming in now, so I'll give them another few minutes.
Please ask questions. I love answering them.
Exactly. Kevin's here. We've got his expertise, so please jump in and ask questions. In terms of your practice, so you're at the Stockton and Tees practice, Kevin, and your checkups, as you were saying, you're kind of seeing patients daily throughout the day. How often would you say your patients come back to see you once they're stabilized in terms of the dental care? And is there a reason that you still advise them to come in kind of every 12, 18 months, etc.?
Well, I must say I'm very much on 6 months. One of the reasons is the mouth cancer. If somebody then is brushing impeccably and, you know, there's no bleeding from the gums and anything like that, it's usually okay. We'll see you every year. If it's not one of our patients where we, for example, just place the implants in, we see them every year to 2 years. But with, you know, we need to know that you're seeing another dentist in the meanwhile. So I'm very much 6 months to a year. I know some people extend it to 2 years. I'm a bit uncomfortable with that, to be honest. A lot can happen in 2 years. So yeah, but of course, I'm not sure if the question was if you find a lesion or something like that. No, it wasn't like that.
Question is, I mean, just the difference between the types of lesions between them. I think you've answered that previously.
Now, as I said, if I think something is very highly suspicious, let's almost think to myself, that's cancer. I'm not even reviewing. I'm sending straight away. I'm referring straight away to the specialist. But usually, if I see a lesion, I tend to review after 2 weeks. As I said, sometimes I take a picture as well. Depends. Sometimes I just describe it. 2 weeks. If I see it's still there, I start to discuss. Okay, let's refer. If it's shrinking or changing for the better, I sometimes even just bring patients back to have another. I want to see that lesion gone. If I don't see it gone, then I'm not gonna. I'm gonna refer, to be honest.
Yeah, good. Well, thank you for your time, Kevin. I just wanted to mention about the Oral Health Foundation. I know they're a foundation that you've kind of talked about a lot as well. They're a national charity who kind of discuss all health needs and focus a lot during Mouth Cancer Awareness Month on mouth cancer. Please visit the website. So it's the Oral Health Foundation. You can type them into Google and visit the website. They're also on all social media, and they give a lot more of information on mouth cancer and the importance of regular dental checkups and what you can look out for at home in terms of signs and symptoms. And they also hold national events throughout the year as well. I believe you.
What they have this really nice, actually. They have cases, videos of people who have had mouth cancer and their journey. They've got a really good website.
Yes, yeah. So if you are after more information on mouth cancer, make sure you visit that. So we'll wrap it up there. Thank you, Kevin, for your time.
Thank you.
Pleased you could join me.
Fabulous.
And thank you, everyone, for watching at home. And we hope to see you at one of our dental practices soon.
Thank you.
Thanks.